Her topic is assessment of lifestyle practices and menopausal symptoms burden among perimenopausal and postmenopausal women attending gynecological OPD.
Good morning, respected chairpersons, judges, teachers, and all my colleagues. I am Dr. Anikta Ekka from the Department of Obstetrics and Gynaecology at Sri Shankaracharya Institute of Medical Science, Bhilai. I'll be presenting my study on lifestyle practices and menopausal symptom burden among the peri and postmenopausal women attending the gynecology OPD. Menopause is a normal and physiological transition, but the symptom burden can be clinically important. Lifestyle factors such as activity, diet, and sleep are modifiable, so routine OPD assessment gives an opportunity for early counseling.
Lights are not changing on the screen.
The assessment pathway begins with the lifestyle profiling, followed by the menopause rating scale, scoring, and once severity is categorized, the counseling can be individualized according to the woman dominant symptoms and lifestyle gaps. The objective was to assess both lifestyle practices and symptom burdens and to understand how unfavorable lifestyle factors align with higher symptom scores among these women. It was a cross-sectional observation study conducted in the obstetrics and gynecology, OPD. The sample included 120 participants, which were peri and postmenopausal women aged between 40 to 65 years attending the routine gynecology services. The data were collected with a structured performer. We recorded the demographic details and lifestyle practices and health-seeking practices. Menopausal symptoms were assessed with the menopause rating scale and categorized according to the severity of the symptoms. The study included 120 participants. Their mean age was 51.8 years. They constituted 46.7% of perimenopausal females as well as 53.3% of postmenopausal women. The most common lifestyle concern was inadequate physical activity, reported among 68.3% of the women, with low calcium rich food intake, poor sleep quality, and irregular dietary habits were also very frequent among these women. The leading symptoms was joint and muscular discomfort, which constituted 70.8% of the female. Sleep disturbance was present in 62.5%. Hot flushes and sweating was present in 56.7%. Irritability in 49+2%. And urogenital complaints in 38.6% of the females. Moderate to severe menopausal symptom burden was seen in 63.3% of the women, which means almost 2/3 of the study group had clinically meaningful symptom burden. The women with sedentary lifestyle, poor sleep, irregular diet, and inadequate menopausal health awareness had higher symptom scores. This supports combining MRS-based symptom scoring with lifestyle counseling in routine OPD care. The intervention priorities are clear: inadequate physical activity, low calcium-rich food intake, and poor sleep quality and irregular diet were all common. These provide practical OPD counseling targets. And on discussion, the finding shows that the lifestyle risk factors are common and that symptom burden is significant. The leading symptoms were joint and muscular discomfort, sleep disturbances, and hot flushes. The association with sedentary lifestyle, poor sleep, and irregular diet support routine lifestyle counseling were encouraged. To conclude, a considerable proportion of peri and postmenopausal women had moderate to severe symptoms, and unfavorable lifestyle practices were common among these women. The routine lifestyle assessment, MRS scoring, and individualized counseling, the study suggested that this should be integrated in the routine gynecological OPD consultation. These are the selected references used in the introduction and discussion. Thank you. I'll be happy to take the questions now.
For what complaint they have presented to your OPD?
Ma'am, for any complaint, when the patient were presented in the routine OPD, they were checked for the RSS caring
No, no.
and
Actually,
lifestyle
is there any
assessment.
relation of your menopausal symptoms to their complaint or any complaint? If
No,
somebody
ma'am.
is having,
Any woman,
HMB also, AUB, all patients you have taken into account postmenopausal.
yes,
It should
ma'am.
have been better that which women are having some problem and they are related to the other lifestyle factors and all these things. For what they have complained? Is there complaint due to menopausal symptom because you have taken patients with perimenopausal symptoms also? So many of the perimenopausal symptoms may not have the menopausal symptoms in a greater consequence. So if the patient, what is the why they have come to the hospital? If you would have taken that type of history, and in relation to that, what complaints menopausal symptoms are there, then it would have been better.
Ma'am, in Indian population, most of the females are they don't openly express those things, ma'am.
Actually, if
No.
some person comes to you to OPD hospital, they might have a SIP complaint.
Yes,
So what was
ma'am.
her SIP complaint? What made her to come to the hospital? That should be the your first ideal thing.
For example, perimenopausal, they can come with AUB. Now, you also have 64 patients postmenopausal. So, those patients with what complaint they came to OPD?
Ma'am, irregular menstrual cycle were very frequent.
No,
The AUB
postmenopausal.
Postmenopausal woman.
postmenopausal, ma'am,
Since you have not taken it as a community
Because,
study, you have
see,
taken
you
it in a
have-
center study. It is not a community study. So it is taken a center study. So for what reason they have come to the hospital? Suppose when you are taking a study in a hospital, for that reason they have come to their hospital, and from them you have taken the study. You have taken your group, and you have considered 120, and with that complaint, what they have come to you?
ma'am, there was the variety of complaints, ma'am. All the
See,
postmen,
will they come to you with joint pains, muscular pains, gynaecopedy, they won't come.
ma'am,
There is
bleeding.
no genitourinary symptom.
Yes, ma'am.
Also, that is the commonest symptom. A postmenopausal women of ever ethnicity will come. Okay. And one more thing, how did you assess that they are taking low calcium diet?
Ma'am?
Low calcium diet. Poor
Ma'am,
calcium.
we asked the leading questions about their daily dietary, like they take the supplements
So
or
did
not,
you have
and
any,
soya bean
any
milk
chart
and
or anything where
yes,
you
ma'am.
could assess that
milk,
what
yogurt
diet she is taking and how much oral
amount she
calcium
is
she is
taking.
consuming?
Yes, ma'am. Yes, ma'am.
Have you assessed that?
Yes, ma'am.
Can you just tell me few things where it is calcium rich?
Ma'am, milk, yogurt, soya bean, and buttermilk. These were asked, and any seafoods like Solomon and the soya beans like this, and
Yeah, you told that.
uh,
So when you are
dairy
doing that,
products,
you
ma'am.
should have that, no? Because you
And sesame seeds were.
there is a chart which
yes,
says
ma'am.
that these are the calcium rich diets and I mean the food products and what they are
In
consuming.
the counseling,
So
we
did
use.
you have any scale for that to say that she is taking poor calcium diet?
Yes, ma'am. There was a not a particular scale, but according to the grams containing in each, like buttermilk may contain 250 grams of calcium.
Buttermilk will
Yeah,
hardly
one-
contain anything less.
100 gram, and milk can contain 250 grams of in one glass.
Okay, yeah, fine.
I have one important announcement. All participants, please stay after the paper presentation is over in the hall itself, because within half an hour we'll declare the results in the presence of judges. So please be here after the presentation.
Moving forward, our next candidate is Dr. M.S. Darshana, and her topic is Assessment of Prevalence of Overactive Bladder and the Effect of Double Voiding Action on Symptom Relief among Perimenopausal and Postmenopausal Women in a Tertiary Care Hospital in Mahasamud.